Hello everyone. So this is the session of Mission INICET2021 Pelvic Clinical Anatomy MCQ discussion. Myself Dr. Monalisa, and let's start with the session. So before starting the session, a brief introduction about myself. I have done my MD Anatomy from Armed Force Medical College, Pune, and this is my referral code, or you can say also the unlock code, which can be used by you if you want to see the free sessions on the Unacademy platform, or if you want to take the subscription of Unacademy. So you will get a 10% discount by using this code. So I also want to tell that free live classes on the Unacademy platform is there, and that is extremely beneficial for the students who want to target their examination. So for that, what they have to do, they have to download the Unacademy app, they have to find their goal as NEET PG, and thereafter they have to use the code ANAT10 to unlock and be the part of free sessions on the Unacademy platform. So my dear students, I would also like to tell you about the special class features. It's an interactive live session. Polls are conducted among the learners. So raise your hand and ask your doubts and get your doubts cleared by the live session. Never miss a session. So if you start seeing a session, for example, if you start seeing my session, you can follow me on the Unacademy app, and thereafter you will get the notification of all my sessions, whether it is free or plus. Now when you complete the session, you will get PDF notes. You can download the PDF notes, and you can revise the session after the session is completed also. So anytime, anywhere, read from the top educators of Unacademy platform, and this will be highly beneficial for you. Use the code ANAT10 and get 10% discount in the subscription, and use this as an unlock code for watching free sessions on the Unacademy platform. I also want to tell you about the plus subscription of Unacademy, which is extremely beneficial, where all 19 subjects will be completed in a very systematic way. So you can study from the top educators of Unacademy platform and who are best in the medical field. Compete with the test and quizzes so that you can have an idea of all your drawbacks, which of the subject needs a better revision. Study on the device of your choice. Assess more than 25,000 MCQs based on latest pattern of MCQs, and 1 year of subscription. You will get 1 year, with 1 year of subscription and more, you will get the printed notes of the Unacademy platform. All these opportunities, grab it, okay, and use the code ANAT10 for 10% discount. Now I also want to tell that not only this, if you want to take the more benefit of two important platforms in the medical field, that is, one is the Unacademy and the other is the Prep Ladder. So you can have the notes of the dream team, printed notes of the dream team of Prep Ladder, video lectures of the dream team of Prep Ladder, clinical integrated version essentials, QBank 3, rapid revision snapshots, and treasure dream notes 2021. So all these opportunities can be taken by you, availed by you. So just go for iconic subscription, and for this also you can use my code ANAT10 and get 10% discount. So my dear aspirants, updated, highly effective QBank of the Unacademy is upgraded with 25,000 and more high-yield clinical MCQ based on the latest pattern of examination, includes a detailed explanation for each and every MCQs. So you will get 10% discount if you are using my code and getting the plus subscription of Unacademy. So NEET PG combat test is there, and I am here to inform you about that. 10th October is the day, 11 years is the timing. Enroll for it. Use the code ANAT10 and enroll for this. This will be highly beneficial. 60 minutes, that means 1 hour session, 45 MCQs. Okay, so just solve it. So till rank 200 students will get the scholarship. So just avail the opportunity of taking the scholarship and do present for the 11 AM session. 10th October is the day. So my dear students, the exam is coming near, INICET2021. So let's have a free grand test for it, okay, every month. So for the month of October, the date is 17th October. The timing is 2 PM to 5 PM. 200 MCQs. Don't forget to give your exam, and let's crack it together. Use the code ANAT10 to get enrolled for the test. Oh, I want to congratulate the students of Unacademy platform who have catered the NEET PG 2021 examination September session with a very good numbers. So I want to congratulate, and I am very glad to share their photographs on this image on this YTube session. I also want to inform you about the batch course starting from the 6th October 2021. Focus FMG batch, Mission INICET21, NEET PG 2022, clinical cases and discussion. All these sessions are starting from 6th October. So just take the subscription, use my code ANAT10 and get 10% discount. Okay, before starting the MCQ session, at the end I am using this slide, which is the NEET PG subscription, which is comparing the details of Plus subscription and that of Iconic, pricing details. So either you go for Plus or you go for Iconic. If you are aspiring for the next examination and if you are in first or second year, go for 4-year subscription. If you are in final year or internship, you can take 1 year of subscription or 2 years. So that totally depends on you, and just crack it. So let's start with the session. Let's start with the first MCQ of today's session. A 45-year-old man is admitted to the emergency department after a violent car crash. Physical examination reveals that the patient suffers from a straddle injury to the perineum. MRI examination reveals that the extravasating urine and blood from the torn bulbar urethra is present in the superficial perineal cleft. Which of the following fascia provides the border for the space? So the options are campus fascia and the scarpa fascia, perineal membrane and the external perineal fascia of Gallaudet, Colles fascia and external perineal fascia of Gallaudet, perineal membrane and superficial fascia of urogenital diaphragm and the apex of prostate gland. So these are the options, and mark the correct answer. So take your 30 seconds and mark the correct answer. Your time starts now. Actually, if I talk about the correct answer is Colles fascia and external perineal fascia of Gallaudet. So actually that is it's easy to identify. Why? Because the word superficial perineal cleft is mentioned. So superficial perineal cleft, what does this mean? That means superficial perineal pouch, which is exactly mentioned, and we know that the boundaries of superficial perineal pouch is, so it is having two layers. It is exactly located between the Colles fascia and between the inferior layer of urogenital membrane or diaphragm, that is also called as perineal membrane, that is also called as perineal fascia of Gallaudet. So C option is perfectly correct. I will show you the diagrams which will clear your concepts. So firstly, let's write what is perineal space and where it lies. The superficial perineal space is also called as cleft, and it lies between external perineal fascia of Gallaudet. Actually this is same, external perineal fascia, don't get confused with the name. Okay, so don't get confused. Actually this is the same fascia, that is the inferior layer or membrane of urogenital diaphragm, inferior fascia of urogenital diaphragm. So it is also called as inferior layer which is covering the urogenital diaphragm, or it is also called as the perineal membrane. So all these things are similar only, it is just given to confuse you. And the underlying below fascia, so in between this and which is the other fascia which is lying inferiorly for the superficial perineal space or cleft, is the Colles fascia. So this is exactly the correct answer. Now coming to the other options, campus fascia and scarpa fascia can't be the correct answer, because these are the spaces these are the fascias of abdominal wall. Campus is the fatty and the scarpa is the membranous layer. So this is not the right answer. Campus fascia and scarpa fascia is indistinguished between both of it. You can find the two layers in the lower part of the abdominal wall, in which campus fascia is fatty and the scarpa is membrane. Scarpa fascia will go lower down in the perineal region towards the penis, it forms Buck's fascia. In the perineal region it forms Colles fascia. Now question number C, perineal membrane and external perineal fascia of Gallaudet. Actually these are the similar things, only given for confusing you, just given for confusing you. So B option is not correct. Colles fascia and external perineal fascia is again not correct. Okay, this we have already done. This is the correct option. Sorry, we have already corrected. That is Colles fascia and external perineal fascia is the inferior layer of urogenital. That is the perineal membrane. Sorry. So C option is perfectly correct. We have already done this. D option, perineal membrane and superior. This is not. Actually, perineal membrane and superficial fascia of urogenital diaphragm. We will talk about this. This is containing deep perineal pouch. This is the boundary for deep perineal pouch. Okay. So urogenital diaphragm and apex of prostate gland, it is not containing any kind of space, so it is not the correct answer. So all other options is perfectly wrong except the option C, which is the correct answer. So now let me show you this diagram. So actually the superficial perineal space is asked, and it lies between Colles fascia and inferior layer of urogenital diaphragm. So see here the definition of two fascias, and deep perineal space is between superior and inferior layer of urogenital diaphragm. Actually inferior layer of urogenital diaphragm is only the perineal membrane, which can also be called as the external perineal fascia of Gallaudet. So see here, this is exactly, so you can see here this dotted line is the superficial perineal pouch, and above it the another space which you are seeing is the deep perineal pouch. Deep perineal pouch is lying exactly between the superior layer of urogenital diaphragm and that of the inferior fascia of urogenital diaphragm, which is also called as the perineal membrane. Inferiorly you can see Colles fascia lies in superficial perineal pouch. So these are just interchanging name to confuse you. So that is the correct answer. Let's move on to the next MCQ, that is question number 2. A 58-year-old post-menopausal woman complains of pelvic discomfort and dull pain. Lymph node from the sacral, internal iliac, linguinal lymph node groups are surgically removed for histopathological examination. The pathology report reveals positive cancerous cells which is found only in the inguinal lymph node. So which of the pelvic organ could most likely be involved in this case of cancer? The options are body of uterus, distal rectum, one or both of the ovaries, the proximal rectum, or the anal canal superior to pectinate line. Superior to pectinate line. And so these are the anatomical reasons which is mentioned, and you have to tell which is the correct answer. So here we have to know the cancer cells are found in inguinal lymph node. So we have to know which of the following area is draining along the inguinal lymph node. So let's start with the answer. The correct answer here is A, that is the body of the uterus. Okay, so actually cancer present in inguinal lymph node can be indicative of the cancer of the uterus, which is exactly at the level of round ligament of uterus. So the most important answer and the correct answer will be the body of uterus. I will come to the other option. Firstly, write down this option. Cancer cells present in, which is lying in the inguinal lymph node, can be indicative of cancers of uterus. Exactly the level is at the level of round ligament of uterus. At the level of round ligament of uterus. And actually these cancerous cells will drain into inguinal region, inguinal lymph node. So this is the correct answer. So we have chosen A as the correct answer. So mainly the more reason of uterine cancer is suspected if you are if you will see, especially if the is normal. If we will see the lower aspect of the structures, actually lower limb and all are normal. So basically these are the uterus cancers. So yes, that is the reason. Now after that I would like to tell you about the other options which was provided also. So a few other options will be also provided. Actually there was all the structures. Important reason is the pectinate line. So one of the important point which I want to define is the pectinate line. So every structure was above the pectinate line. So pectinate line is actually marking the end of mucosal lining of the anal canal, and below which the anal canal is limited by the lining epithelium, that is non-keratinized stratified squamous epithelium. So pectinate line marks the end of mucosal lining of anal canal. And below this level, what is the lining epithelium? Non-keratinized stratified squamous epithelium. Non-keratinized stratified squamous epithelium. Okay. The patient is actually, when we are talking, actually the pectinate line is also distinguished. How you can be distinguished? I will show you a diagram where the ends of the anal canal column and anal valves. At this level, the end of the anal canal and anal valves line. Lymphatics inferior to pectinate line will drain in superficial inguinal lymph. So, if we talk about the lymphatics, see here. So, here all the lymphatics is not inferior to pectinate line, it is superior to pectinate line, proximal urethra, ovary, all are superior, no one is inferior. So, lymphatics will drain inferior to pectinate line. So, when we are talking about the lymphatics, so it is important to know that lymphatics which is of below to pectinate line, will drain into superficial inguinal lymph nodes. Will drain into superficial inguinal lymph nodes. Got it? And above, what about above? Above will drain into internal iliac lymph node. Above will drain into internal iliac lymph nodes. Above will drain into internal iliac lymph nodes. When we are talking of the lymphatics of the ovary, one of the option was lymphatics of the ovary. So, if we talk about the lymphatics of ovary, it drains into the para-aortic lymph node, which is lying at the level of kidney. So, we have to choose one. So, we have went with the answer that was the body of the uterus. So, again I will show you the pectinate line in the diagram. So, what you can see here, that is, this is actually this anal canal and anal valves. Okay, anal column hai ye, anal columns hai, columns of Morgagni. This line, that is anal walls, if we draw a transverse line at this level, this is the pectinate line, and below this level the drainage is into inguinal, superficial inguinal lymph node. Above it is in the internal iliac lymph node. So, we have to choose one. So, we will go with the body of uterus as the right answer. So, that is the reason that body of uterus is the right answer, because inguinal lymph node was suspected with the cancer cells. Now, let us move on to the next MCQ, that is MCQ number 3rd. A 47-year-old woman with 3 children and a family history of breast cancer mutation in BRCA1 and BRCA2 gene have made a decision to get an elective hysterectomy as a prophylactic treatment. So, during ligation of uterine artery, which of the following adjacent structure is susceptible to get injured? Ureter, internal iliac artery, internal iliac lymph node, obturator nerve, or lumbosacral trunk. So, according to you, which is the correct answer? Okay. So, yes, according to you, which is the correct answer? Your time begins now. You will get 30 seconds for solving this MCQ. So, that means you have to know the relation of uterine artery with most important structure, which is lying very close to it. So, that is the hint which is provided here. So, my dear aspirant, the correct answer is ureter. Ureter is the correct answer. Actually, during hysterectomy, that removal of the uterus, ligation has to be done for the uterine artery. So, it is important that we should know the most important structure lying in the proximity. So, actually, when you will see the relation of ureter, I would also like to show you a diagram. The ureter and uterine artery is lying very close to each other. Okay, they are lying very close to each other. So, actually, what happens when uterine artery is ligated, that there can be a chance that the ureter is injured. So, ureter is exactly located immediately inferior to the uterine vessel, and we use a commonly a language that is water passing under the bridge. So, अभी हम क्या समझेंगे, जो हमारा यूट्राइन वेसल्स है उसके बिलो यूरेटर जा रहा है, यूरेटर में यूरिन पास हो रहा है, तो वाटर इज लाइंग बिलो द ब्रिज and it is the most commonly affected structure among the option provided. I would also like to tell you about the relation of other structures. So, but ureter is the right answer. So, let's firstly write down the relation of ureter and uterine vessel. So, yes, we have got A as the correct answer. Now, let's write. So, during hysterectomy, if the operation is hysterectomy, the structure to be ligated is uterine vessel. That means uterine vessels has to be ligated. That means the structure lying very close to uterine vessel is to be known. That would be susceptible because of its location. So, actually ureter, when we are talking about ureter, it is lying immediately. Ureter is lying immediately inferior to uterine vessels. Ureter is lying in exactly immediately inferior to uterine vessel, and it is talked as water passing below the bridge. How you can remember? Water means ureter is having urine, so it is water passing below or under the bridge. Exactly, the location is in the, it's approximately 1 centimeter lateral to supravaginal cervix. This location is exactly 1 centimeter lateral to supravaginal cervix. Supravaginal cervix. So this is the reason we have got the correct option. Now let's see the other options also. So let's see about, so we have got correctly ureter as the correct answer. Internal iliac artery, why it is not the correct answer? Internal iliac artery divides, actually its bifurcation takes place. So internal iliac artery bifurcates, as you know, in anterior and posterior division. So it bifurcates into anterior and that of posterior division at the level of pelvic brim. So it is not exactly lying very close to uterine vessels, and we know that uterine vessel is, again, uterine artery is a branch of internal iliac artery anterior division only, so it is not lying close to it. Internal iliac lymph node, not the correct answer, because that will be arranged, these lymphatic nodes will be arranged around the internal iliac artery only, so vessels only, so this is not the correct. Obturator nerve. So obturator nerve is traversing towards the pelvic side wall, and it is lying very, it is not lying very close to that of uterine vessels. I would actually like to show you a diagram where the relation of lumbosacral trunk, obturator nerve, sympathetic chain on the ala of the sacrum we will see. Lumbosacral trunk is also located on the lateral side of the sacrum and in the pelvic side wall. It is also not lying very close. It is also not lying very close and in the close proximity with the uterine vessel. So first thing is to show you the relation of ureter and that of uterine vessel. So what you can see in this diagram, you can clearly see the uterine artery and the uterine vein. So this is exactly the uterine artery and uterine vein. So just below it, what you can see, the structure residing is the ureter. So what you can see? Yes, it is exactly lying inferior to uterine vessel. It is exactly lying, as you can see, it is exactly lying inferior or below the uterine vessels. You can say water passing below the bridge and approximately lateral, approximately 1 centimeter lateral to supravaginal junction. So cervix and the vaginal junction, as you can say here. Supravaginal part of the cervix actually. Now, the other thing is that, see here, this is a common iliac artery, this is the internal iliac artery, and you can see here, if I enlarge, internal iliac artery is dividing here into, its bifurcation is occurring into anterior and posterior division. So here the branches, this is a posterior division, branches are lateral sacral, superior gluteal arteries and iliolumbar. So these are the posterior division branches, and these are all anterior division branches. So this is occurring at the level of pelvic brim. So this is also not exactly lying at the close relation with uterine vessel. So that means we know that uterine artery is again a branch of anterior division of internal iliac artery. So it is very far away. So this can't be the right answer. See here, I have included this diagram in which all the branches of internal iliac artery can be seen. So lateral sacral, superior gluteal and iliolumbar, these are the three branches of posterior division, P for posterior division. And here you can see the anterior division branches, obliterator umbilical artery, superior vesicle, obturator artery, vaginal or inferior vesicle, and artery to ductus deferens corresponds to uterine artery in case of males. Middle rectal, internal pudendal, inferior gluteal. So all these AA which I have written are the branches of anterior division. So you can clearly see that it is lying very inferior to that of the bifurcation which is taking place at the pelvic brim. So it is not lying in close proximity with that of the uterine vessels. The bifurcation, you can see a bifurcation is lying at the level much above than the uterine vessel. So this can't be the correct answer. Now I also want to see, as the option which was provided was also the obturator nerve, lumbosacral trunk. So can you see the relation of these structures from lateral oils. Oils is the mnemonics for the relations at the ala of sacrum. So from lateral, most laterally is obturator nerve O, I for iliolumbar artery, L for lumbosacral trunk, and the most medial one is the sympathetic chain. So these are the relation of structure from lateral to medial, oils. So you can clearly see this is not lying. So we can say that obturator nerve or lumbosacral trunk is not lying very close to that of Uterine vessel. So one of the structure which we have to pick. So we will go with which structure? Ureter, which is passing below the uterine vessel. So yes, done with this. Now let's move on to question number 4. A radiologist observed a pelvic MRI scan of 22-year-old pregnant women and measured the distance between the sacral promontory and the superior margin of pubic symphysis. So which of the most likely measured by the radiologist? So the characteristic point which is mentioned is promontory of the sacrum and superior margin of pubic symphysis. You have to tell me whether it is inlet, sagittal inlet, sagittal outlet, whether it is bispinous inlet, whether it is the maximum diameter of the inlet, or whether it is bispinous outlet. So these are the options provided and you have to mark the correct answer. So your time starts now. You will get 30 seconds for marking the correct answer. Got it? Okay. The correct answer is pelvic inlet. So actually the other name of pelvic inlet is sagittal inlet also. So C is the correct answer. Actually sacral promontory posteriorly and anteriorly superior margin of pubic symphysis is the boundary for the pelvic inlet, which is also called as pelvic brim. So it is marking pelvic brim or the pelvic inlet. And the other name of pelvic inlet is that of sagittal inlet. So we will go with C option, perfectly correct. So please write this. Pelvic inlet is also called as pelvic brim, and this pelvic brim is also called as sagittal inlet. These all are similar things only. These all are similar part. Boundaries. So the boundaries are posteriorly the structure residing is sacral promontory, anteriorly the structures lying is symphysis pubis, superior aspect symphysis pubis, and laterally it is bounded by iliopectineal line, laterally by iliopectineal line. Laterally it is bounded by iliopectineal line. So this is all the boundaries for the pelvic inlet, pelvic brim or sagittal inlet. Now talking about, so see here the same thing I want to show here. So you can see here posteriorly sacral promontory, also coming to the ala of sacrum, margins of the ala of sacrum, then residing towards this line, that is the arcuate line, pecten pubis and pubic crest. Together these three important points, that is pubic crest, pecten pubis, arcuate line, is called as linea terminalis. Arcuate line, pecten pubis, pubic crest, and anteriorly is the superior aspect of the pubic symphysis. So this whole marking which has been shown here is showing you the margins of pelvic brim. So this was corresponding to the option. So we have chosen pelvic inlet or the sagittal inlet as the correct option. The outlet. Now talking about the outlet. So can you see here, this bone is the coccyx bone. So the outlet, when we are talking about the pelvic outlet, that is also called as you can say sagittal outlet, it is bounded posteriorly by coccyx, laterally by ischial tuberosities, laterally ischial tuberosity, and anteriorly it lies the pubic arch. So this is for the pelvic outlet. This is the pelvic outlet. So got it. So yes. So that means sacral promontory, superior aspect of pubic symphysis, correctly the pelvic inlet. Bispinous outlet is not the correct answer. That is the distance between the ischial spine. That is the ischial spine. So it is not the correct. Bispinous inlet is also, that is actually the distance between the ischial spine. So it is not correct. Maximum transverse diameter is the most greatest dimension of the whole of the pelvic cavity. It is nothing to do with the pelvic inlet. Outlet is especially not the correct answer. We have just seen because coccyx is lying posteriorly in the outlet. So C is the correct answer. Now let's move on to the next option, that is option number 5th. 78, so see here, now a 35-year-old woman is undergoing a tension-free vaginal tape procedure to repair the inguinal hernia. 2 days post-operatively, the patient has high fever and shows the signs of hypovolemic shock. Radiographic examination reveals that the vessel crossing the pectineal or the Cooper's ligament as it descends into the pelvis was injured by a staple, confirming the presence of so-called arterial circle of death. Key point, arterial circle of death. So, which of the following artery is injured? So, your time starts now. 30 seconds will be given to you, whether it is obturator, whether it is aberrant obturator artery, whether it is superior vesicle, whether it is middle rectal or inferior vesical artery. Actually, it is exactly giving the answer by the arterial circle of death is mentioned and the condition is seen, and we have to go staple से बहुत important structure है. The signs of shock is there. The signs of hypovolemic shock means bleeding has occurred, high fever. So, the correct answer will be injury to obturator artery, that is the aberrant obturator artery. What is aberrant obturator artery, dear? Actually, when in cases of females we want to repair the inguinal region, so it is seen that the surgeon should take care of this aberrant obturator artery, which is seen, it is a normal variant in approximately 20 to 30% of the individuals. Okay, and at times due to mistake the surgeon can injure this artery, and actually this aberrant obturator artery is a branch from the inferior it is a branch from inferior epigastric artery. It is a branch from inferior epigastric artery. So, write down aberrant obturator artery is seen in 20 to 30% of the cases, and it is a branch from inferior epigastric artery.
In human anatomy, inferior epigastric artery refers to the artery that arises.
And at times during the repair,
Do you want me to keep reading?
at times during the repair, what can happen? At times during the repair, the injury can be happening of aberrant obturator. Sometimes it is lying very close to the lacunar ligament, also medial aspect. So, in that case, surgical repair, this artery can be injured, and if it is injured, bleeding can occur. A heavy bleeding can occur, and the patient can go in hypovolemic shock. So, see here. So, this is a case where abnormal obturator artery, which is a branch from inferior epigastric artery, has been shown, and for treatment, and it is lying related to lacunar ligament, and if it is enlarged, there can be chance of heavy bleeding if it is not taken into account. So, actually this is also called as corona mortis, because the crown of death. Why crown of death? If it is aberrantly injured or it has been cut, severe bleeding can occur, and it is also called as corona of death. It is called as crown of death, sorry, crown of death. Abhi corona ghum raha hai dimag mein, sorry for it. So, it's like crown of death. So, aberrant obturator artery is the correct answer. So, yes, we have done with this. I will come up with new sessions. So, for INICET NEET PG exam, FMG ke liye most of the sessions will be in the special class. So, all the best, keep studying. So, before ending the session, I want to tell those who are interested for the session, they should download the Unacademy app every Wednesday. So, not only every Wednesday, I will take the series in consecutive sessions also. I will let you update about, and link will be provided in the Telegram group. So, Wednesday is the special class free session. Use the code ANAT10 to unlock and be present for the session, and it will be highly beneficial. So, NEET PG Compact, I want to give you the information about NEET PG Compact. 10th October is the date, 11 AM is the timing. 11 AM is the timing. Enroll by using the code ANAT10. So, till 200 rank students will get a scholarship of 1 year scholarship of plus subscription from a 1 crore pool. So, just grab this opportunity. All the best. Thank you so much. Thank you, students.